Right. Uganda is facing rising trends of non-communicable diseases and specifically dietary related. We have many people who are silently dying because of the food they ate, or because of the food they are eating, or because of the food they are exposed to. So right now, 33% of the Ugandans are dying because of food. And then we have many people in the Cancer Institute, in the Lung Institute, in the Heart Institute, battling food-related diseases. So right now, if you're Ugandan, there is a probability, the chance is 22%, that you are likely to die of a dietary-related cause. So we need always to look out for what we are eating and how we eat it and where we eat from.
Now, there's a report that shows that children are more at risk of getting the non-communicable diseases. How is this even the case?
Many children in Uganda are in imminent danger because of the following reason. One, when you read the statistics from the Cancer Institute right now, the cases, the new cases of cancer from children surpasses the cases of older people. To a tune of 700 patients of children per year compared to adults. This is the case. Many children are now in school, and in school they find themselves being exposed to food that is in excess sugar, in excess fat, and also excess salt. The canteens are another death trap for your children. If you have children in your home, if they are in a boarding school or in a day school, whether government school or private school, you need to watch out, because many of them are not yet of the age to understand even the commercial intent. So companies in Uganda, food companies, have the liberty to market to your children. They promote, they entice them, they give them gifts, they hook them up when they are young, because they know that children have what they call pester power. If a child wants to eat something, they'll, they use their power against their parents, and the parents will yield to that power. So eventually we've seen that many children are having stomach ulcers, stomach cancers, colon cancers, and many other non-communicable diseases, including diabetes, that used to be, a sickness or a disease for all the people, including heart diseases.
Simply break it down for us, how food is a contributor to NCDs in Uganda. So
food, interestingly or unfortunately, is now causing death. How or why? Many people do not understand the labels on the food. So when you enter a shop or a supermarket, or you enter an outlet that processes ultra-processed food, you just buy. And in many of these cases, the food company lists food with ingredients that make it very sweet, but in it there is addictive agents. So many people eat without knowing. This is why we have many people who are overweight, others are now obese, and then that causes hypertensive disorders, cardiovascular diseases, all because they are eating, and what they are eating is high salt, is high in sugar. Well, our bodies need sugar, and scientists will say that. So as we conclude this World Food Safety Month, science must be at the game of it, and science has concluded, including World Health Organization, that food that is high in salt, high in sugar, high in fat, and also some food that is prepared using trans fatty acids, including French fries, including confectionery, many of the cakes you people eat, the bread on the market, is prepared using trans fatty acids, which must actually have been already banned in Uganda, but they are still on the market, and many people are still eating it. And the children always served with such food, including kindergarten children, because many parents don't want either to cook, or they find that buying from a supermarket or a shop is easier, so they just buy and give their children.
Now, this problem seems to be taking on the country's next population. How do we get out of it?
So getting out of this is the simplest. Actually, when you look at the non-communicable diseases burden, those that are brought up by food are the easiest to prevent. First, we can start with parents when it comes to children, to be conscious about what you give your children. Secondly, is the adults, not to just eat. Actually, what you eat is what you become. Then the third issue is because now our environment is full of the marketing, trade in food. We need the government to come in. We are respectfully and asking Ministry of Health, we want to thank you. You are doing a good job, but we want to thank you to expedite the passing of the nutrient profiling model, because today a Ugandan may not know whether this food is bad or this, I should eat this or leave this out. So we want to ask you, dear Ministry of Health and the government at large, to expedite the passing of the nutrient profiling model, such that Ugandans can tell, this is good food, I should eat this, this is good food, or I shouldn't eat this, or I should eat this in moderation. Without these rules and regulations about the food industry, many Ugandans, whether young or old, will end up either not serving themselves economically due to ill health, or many of them are going to die prematurely.
Thank you very much for